What could be a common cause of both low back pain and cardiovascular disease? There can be many reasons why we develop low back pain. One of the reasons is intervertebral disc degeneration. So, how can a degenerated disc in the low back have anything in common with cardiovascular disease? Think about it this way and it will start to make some sense. All tissue in the body needs adequate blood supply to provide nutrition for tissue regeneration. If the blood supply is compromised, the tissue will start to degenerate. The disc does not have direct blood supply, but it is dependent on diffusion from blood vessels at the disc's margins. When the lumbar arteries and the middle sacral artery were evaluated, it was found that people with one or more occluded or narrowed arteries were 8.5 times more likely to have suffered from chronic low back pain than were those without such findings. Stenosis of the lumbar middle sacral arteries were found on average 5 years earlier than atherosclerosis of the coronary arteries. Research has also documented a connection between cardiovascular risk factors and low back symptoms. Disc degeneration was found to be associated with occluded lumbar middle sacral arteries, and patients with above normal LDL cholesterol levels had more neurological symptoms. Patients with a symptomatic herniated lumbar disc have shown significant higher triglyceride levels and higher total cholesterol levels than patients without disc herniation. Inadequate blood supply feeding the intervertebral discs results in earlier disc degeneration, and inadequate blood supply to the heart can result in a heart attack or heart failure. Why do we get arteriosclerosis, which is deposits in the arteries? I will explain more about that in the next article, and I will also tell you what you can do to help prevent it.